Are you curious about how you can evaluate your autonomic nervous system? Today, we're going to talk about a very specific clinical assessment utilizing your pupils to help you get a better understanding. So hi, my name is Dr. Arianne. I'm a functional medicine practitioner, doctor of physical therapy, registered dietitian, and owner of the Movement Paradigm Integrative Health Center. And as you know from my channel, I love talking about the nervous system. So let's dive in. So one clinical way that you can assess your autonomic nervous system is by actually observing your pupil size and reactivity during an inhalation and exhalation, your normal breath cycle. So normally the pupils are going to dilate slightly on the inhalation, a sympathetic response, and they're going to constrict ever so slightly on the exhalation, which is a parasympathetic response. So lack of this dynamic response may indicate some imbalances in autonomic nervous system regulation, but it's just one piece of the puzzle. Of course, a comprehensive evaluation should also include a detailed history, understanding of your own bioindividuality, of the different aspects of your nervous system for each individual. So it really is important to have a holistic approach that ensures a deeper understanding of your nervous system function and overall health. But today we'll focus on this very specific technique. So this is referred to as the Samogyi Reflex, which describes this rhythmical fluctuation in pupil size that occurs in response to the normal autonomic nervous system's interaction with the respiratory cycle. So again, on your inhalation, we're going to activate the sympathetic nervous system. So this leads to this pupil dilation. This is part of our normal fight or flight response, where the sympathetic nervous system is primed and the body is ready to respond to a potential threat. When we exhale, the parasympathetic nervous system is going to result in this pupillary constriction called meiosis, and it's associated with that rest and digest state, ultimately promoting relaxation and recovery. So the clinical significance of this is that it can be a marker of autonomic balance as it reflects this dynamic interplay between the sympathetic and parasympathetic branches during the natural respiratory cycle. So any type of abnormalities in this reflex, such as something that's reduced or it's exaggerated in these pupillary changes, may indicate autonomic dysfunction or imbalance. What are some things that this could be associated with? Stress, chronic fatigue, neurological disorders, postural orthostatic tachycardia syndrome, so POTS, trauma, vagus nerve dysfunction. So ultimately, when we're assessing this, you can assess yourself, but you're essentially assessing your pupil size while inhaling and exhaling. So you can look in the mirror to do this and just recognizing that it should dilate ever so slightly, and then it should constrict ever so slightly. So you might not notice it the first time. You might have to do this a few times to really see it. But ultimately, if we're seeing this underactive or overactive response, then we know we might want to include different strategies like vagus nerve stimulation, breath work, other nervous system and somatic practices to help regulate the nervous system. So as always, we want to remember that this is part of a comprehensive assessment. So please make sure to use this as one particular bit of information among lots of things that you're looking at as it relates to the nervous system, which is quite complex. So as always, thank you for joining. I hope this was helpful. Give it a like, give it a share, subscribe to our YouTube channel, of course, and make sure that if you feel like you need help with your nervous system regulation, we have lots of programs on our app, a specific nervous system bundle. We also have an 8-week vagus nerve and somatic healing program. And of course, if you need individual help, please reach out to us for a free discovery session. We would love to help you on your journey. Thank you, as always, for being here and your support. I look forward to seeing you next time. Bye.